Hello students, in the previous two lectures we have already covered the requirements and the classification to some extent. So we are going to continue it again. I am Dr. Barkha Bhoneja, a senior lecturer of the Department of Prosthodontics, BBD Dental Sciences, BBD University. So let's continue. As you can see, we have already covered all of these things. And we were on to a class 2B articulator. So we have already completed the monsoons articulator. Now we'll go to class 2C. So class 2C is the instruments. Going to a certain recap of class 2. A class 2 basically is an instrument which can take your static centric relation record, that is the horizontal movement, and also permit a literal horizontal movement as well, that is the eccentric motion. So these class of articulators are basically permit eccentric motion based on the engraved records obtained from the patient and will not accept a phasebow transfer. Now the phasebow transfer is not accepted on all the class 2 and class 1. It starts accepting from class 3 type of articulators. Now the engraved records of the patient which has been obtained are transferred into the articulator. So the House articulator was the first articulator which was designed by M.M. House in 1927. So the cars are mounted arbitrarily. The instrument is adjusted by means of a needle house chewing method. So if you know your basics, you can see how do you record your eccentric so that is the horizontal centric relation. You have a method which is called as a nasal house technique, chewing technique. So we take that nasal house chewing technique method to centric relation, and which employs four metal struts in the upper occlusal ring, followed by a lower compound occlusal ring. You ask the patient to move, and you get the recordings at the on the compound rim. So these recordings are just move on to the articulator. It is mounted. The values are obtained from the engraved patients already, which are already fixed, and you mount the cast literally. Class 3 type of articulators. Now these type of articulators are basically articulators which will accept your vertical records, your horizontal records, as well as your phasebow records. So intercondylar distance cannot be adjusted in these patients. So a new average value articulator is the Hanau mate. There's a class of Hanau articulators. One of the articulators is Hanau mate. You do not need to go into that detail. It is an Archon instrument. Now, the Archon and non-Archon concept I have already told you in the previous lecture. That is, if the condyle is present in the lower member, which is similar to that which is present in our mouth, is called as the Archon. The Archon stands from articulating condyle and will accept a phasebow. And non-Archon are when the condyle is present in the upper member, which is called as a non-Archon. So it has an average horizontal condylar guidance of 30 degrees and a Bennett angle of 15 degrees. These are average values. So this class of articulator, which accepts the phasebow, is also based on the average values. Okay, so this is class 3 type A. Type 1 or type A articulator, where the recordings are based on the average horizontal condylar distance and a Bennett angle. The incisal guide table has an average value of 10 degrees for both protrusive and lateral movement. Okay, so the incisal guidance is already set. The upper member is removable from waxing easy by releasing of the two condylar rocks. So there are two types of articulator. Either they have an open condylar path, whereas the condylar path is open, whereas you can remove the upper member. And there is a closed condylar path, where the condylar path in the articulator is closed and you cannot remove the upper member. So this now mate that we are talking has an open condylar path, whereas the upper member can be removed, and it will not accept static protrusive lateral interocclusal records. It will actually accept static protrusive and lateral horizontal records. Now there are two types again that I told you, type A and type B in class 3. So type A kind of instrument in this class accepts a phasebow transfer, a protrusive interocclusion. Okay, now you accept a protrusive interocclusal record, but lateral cannot be recorded from the patient. It has to be averagely calculated with the formula as I've told you before, is H is equals to L is equals to h upon 8 plus 12. The most popular instrument of this class was the Hanau Model H, designed by Rudolf Hanau, a mechanical engineer, 1923. So you have to mind that it was fabricated by a mechanical engineer. Articulator accepts a phasebow transfer. The most important point in every sentence is it accepts the phasebow transfer, whereas in class 2 and class 3 it was not accepting a phasebow transfer. And the horizontal condylar inclinations are set by a protrusive interocclusal record. Read the line carefully that the horizontal condylar inclination, that is, your protrusive record, can be adjusted into the articulator. The condyles are on the upper member. The condyles are on the upper member, that is making it a non-Archon type of instrument. The Bennett angle L was calculated from the horizontal condylar inclination by means of a Hanau equation. L is equals to h upon 8 plus 12, as it has been stated. Okay, now moving on to class 4 is the instrument in this class, class 3B, that is type A was average value based articulator, where you can take a centric, where you can take a protrusive, but the latter was calculated on the average values. In class 3 type B, the phasebow transfer is there, the protrusive, and also some extent you can take a lateral interocclusal records that will be put into the articulator. Articulators such as true-bite articulator by Geissy, the kinoscope by Hanau, tripod type of articulator by Stransberry, the knee articulator by DiPietro, the Hanau 130-21 by Richard Bew and James Janik. So these are all the types of articulators which are class 3B. A new articulator, the Panadent, was designed by Robert Lee and utilizes interchangeable pre-formed curved analog for condylar pathways. It is an Archon instrument with a fixed intercondylar distance. So basically what they are saying in the last paragraph is that the fossa in which your condyle in the articulator will be moving has a curved pathway, and it is an Archon type of instrument, but the intercondylar distance cannot be changed. So this is class 3B. In the next lecture, we'll see what is class 4. Okay, thank you so much. We'll wait for the next recording.